So these are the questions from musculoskeletal system. In evaluating the appropriateness of various exercise enjoyed by a patient with osteoporosis, the nurse should recommend. So what you need to explain can be given for a patient with osteoporosis. What is exercise? It is walking. Yeah. What is the main sign of osteoporosis? Kyphosis. What is the cause for osteoporosis? Please remember the medication. Medications which is caused osteoporosis. What are the medications cause osteoporosis? Steroids, antacids, and OCP. Okay. Steroids, antacids, and OCP. And smoking is also considered as the risk group. Fine. And the sign of osteoporosis is kyphosis over the thoracic area, and there will be cervical lordosis. Okay, so you can just learn this kyphosis, and the basic reason for this is hormonal changes. Decreased estrogen level always causes osteoporosis. Okay, so exercise of osteoporosis and medications which causes osteoporosis, sign of osteoporosis, majority of all causes. Okay, these are the questions, frequently asked question. And the complication of osteoporosis is pathological fracture. What type of diet you will administer? Calcium rich diet. So please learn calcium rich diet. What are the example of calcium rich diet? Dairy product, broccoli, fish. Okay. Next question. A hospitalized patient has fallen from a bed. The nurse notes shortening of left leg, pain upon movement of left leg, and a rapid shallow respiration. What action should the nurse take first? Shortening of affected extremities is the sign of dash. Shortening of affected extremities is the sign
of fracture.
Hip fracture. So the answer is immobilizing the patient. Next question. While caring for a patient prior to surgery to amputate the leg, what is the most effective measure to prevent phantom limb sensation after the amputation? What is phantom limb sensation is Sajita? First of all, can just mute your mic, and Sajita, you can just turn on your mic. Sajita, leave you. Okay, so what is phantom limb sensation? It is false belief. Yeah. So it should be controlled, it should be reduced by controlling pain prior to surgery. അത് മുറിച്ച് കളഞ്ഞ കാല് സ്റ്റിൽ അവിടെ തന്നെ ഉണ്ടെന്നുള്ളൊരു ഫീലിംഗ് ആണ് usually phantom limb sensation, and the patient may complain pain. Okay, phantom limb sensation mainly with another tingling sensations, pain. Okay, fine. So the answer is A. Next question. Marathon runner experienced sudden onset of sharp pain and cough immediately after a workout. The nurse in the clinic note mild swelling of the calf and tenderness to touch. Which of the following would the nurse suspect the patient is experiencing? Sharp pain. Sharp pain of calf after workout. Which of the following would the nurse suspect the patient is experiencing? Bursitis, tendonitis, plantar fasciitis, joint dislocation. So this is indicating plantar fasciitis. So the answer is plantar fasciitis. Okay. So what is plantar fasciitis? Say, look at this. This is plantar fasciitis. Plantar fasciitis is inflammation of plantar fascia, mainly overstretching of overuse of or overstretching of plantar fascia causes inflammation, and main risk factors for plantar fasciitis is foot arc problem and obesity and long distance running, tight Achilles tendon, and shoe with a poor arch support. So these are the risk factors and the signs and symptoms, which include pain and stiffness in the bottom of the heel. Okay. And you can just apply hot application and cold application to reduce inflammation, and taking rest and wearing appropriate arc supported shoes that will reduce the problem, and exercise to strengthen the muscle. So plantar fasciitis is usually expected complication for a marathon runner. Okay, and next question, a nurse is evaluating a patient 5 days after right total hip replacement. Which of the following goal is appropriate for the patient? Maintain hip abduction without dislocation, and rest with the leg elevated while sitting, tie shoes and put on undergarments without assistive device. So the answer is maintain hip abduction without dislocations. Very good. And see, you will get many questions related with the hip replacement surgery. Immediately after hip replacement, what are the interventions? You will get that questions. And how do we take care of patient following hip fracture? Okay, so please look at the picture. Post hip fracture, what are the interventions that you need to do? Coughing and deep breathing is important. Main thing to reduce DVT, DVT stocking is important. Okay, so you can give star to this. This is very important. And every secondarily turning the position is important. but while changing or turning the position, you need to use abduction pillow. Okay, so leg abduction is very important. What is abduction? Keeping away. Okay, and neurovascular status need to be assessed. How do we assess neurovascular status? You have to assess the temperature, pulse, and color. Three things: temperature, pulse, and color of lower extremities. Pain to be controlled and mobilized as early as possible, as soon as possible. Okay, so that is a nursing care. So immobilizing the client with a abduction. Okay, so complication, DVT, neurovascular complications, bleeding and swelling, pulmonary embolism, and pulmonary complications like atelectasis. Atelectasis will be always associated with anesthetic medications. And bed sore, urinary retention, and UTI. Okay, so the main complication I to consider in the okay, this is how you need to take care, or these are the complications, and you have to take care or start measures to prevent all these kind of complications. And hip fracture, what is the sign of hip fracture? Please look at this picture. This is something very important. Hip fracture like sign നോക്ക് ഇതിനകത്ത് ഇതാണ് ഒരു leg, രണ്ട് leg ഇവിടെ തന്നിട്ടുണ്ട്. ഇവിടെ ഈ കാലിന്, this is an affected leg where the height of this is reduced. So shortening of affected extremity is one sign, and there will be pain. Patient complains pain and adduction. Both legs came very closer. Adduction and external rotation. See, look at this leg. It is externally rotated. So how do we assess hip fracture? Hip fracture ulla patient na shortening of affected extremities undav, adduction undav. Okay, so since the patient has adduction, you have to correct the proper position by abducting. മനസ്സിലായോ? അപ്പൊ adduction, external rotation, ഇതൊക്കെയാണ് hip fracture നെ indicate ചെയ്യുന്ന signs. Fine. And basic reason for hip fracture, one is old age and female, history of osteoporosis, and basic reason for osteoporosis is decreased estrogen, and the patient had a fall. Okay, so then a basic reason for hip fracture. How do we manage? Surgery, if possible surgery, otherwise the other management like hydration, respiratory support, circulatory check, pain control, prevention of immobility complications, and treat chronic conditions and with medications. Okay, so sign of hip fracture, please remember. And the treatment for hip fracture, other than the symptomatic treatment, surgery, buck extraction, immobility. Surgery, it is an internal fixation. After surgery, how would you manage? Okay, so regarding this, you will get many questions. Okay,